Hi, Dr. Ramsey.
Hi there. How are you, Jane?
I'm simply perfect. And this day is getting even better because I have a Spartan in the house.
Hey, go green.
It's kind of a big weekend here in Michigan. Michigan State plays the University of Michigan. And where's the game located this year?
East Lansing.
It's right in East Lansing. Well, that's perfect.
Only place in the
So my friend, Dr. Ross Ramsey, who is my guest here this afternoon, appears to be a Michigan State fan because we can see Sparty in his office, and he did indeed go there. So, but welcome. Thank you so much for joining me. As I was explaining earlier, what Sue and I are trying to do with our lives until the end of the year is really capture the experience of like what is it like to be on a transformational journey? What is it like to work in a place that is, attempting to transform its culture, which certainly your organization, Sure Healthcare, located in Pigeon, Michigan, has done an amazing, crazy job. But it wasn't like a light switch turned on one day, right? Right? There's work to be done. There's work to be done. And you have a full-ish time medical practice, but a part-time executive position on the senior leadership team. And departments actually report to you.
Correct.
Not all physician departments, which I think is way, way cool. So are you a CMO, a chief medical officer in that, or what is your title?
Essentially, CMO. I'm our Vice President of Quality and Medical Affairs. So I do have the quality, innovation, IT departments, plus a few others report directly to me. So I am in the mix in terms of day-to-day operations on top of helping manage the medical staff, if you will, and make decisions on the executive senior leadership team.
Great. And I know you're a great member of it. I was teasing Dr. Ramsey earlier because when Sure had us come back last fall, it was almost a year ago, like in a couple of weeks, it'll be a year, to do a 2-day leadership immersion of the leadership bundle. Dr. Ramsey had the misfortune of sitting right in front, and everybody who's been in my audience knows that that's a really horrible thing to do. But I was so glad I was helpful because you had been on call all night and worked all night long, and I kept you awake. It's a bonus. The other physicians in the room were like, keep picking on him, keep picking on him. So I know you are well loved for your organization. But I really want to talk to you about the physician experience when it comes to a cultural transformation and really working hard to engage employees, engage physicians, and to provide a safe and satisfying patient experience, of course. And everywhere we go, people ask us, how are we going to get our physicians on board? How are we going to engage physicians? We know they won't want to do this, right? I mean, we hear it all the time. And I know you shared with me that you've always been very proud of your provider group in that they are very, very engaged. And when you say very, very engaged, describe what an engaged physician looks like.
Well, myself.
Well, there you go. Yes, for sure. The leader, role model.
So a very engaged physician is someone who actually cares about what's going on in their organization and really puts effort into making sure that their organization is doing well. Not just the patient in front of them, not just their clinic day or making the gears turn, but actually caring about how and why. Once you get that engagement, it's incredible how that why and how just drives them to really not only become engaged, but really, really excel at the quality of work that they provide. So it really is a win-win for everyone. When you get your physicians engaged, just the quality work they pump out is just through the roof, and everyone follows their lead. Once you get those physicians rolling, nurses, your MAs, your everyone, housekeeping, everyone just really follows that lead, because whether physicians think so or not, there's certainly those leaders that may not have the title, but certainly are watched.
Absolutely. Absolutely. And that makes the job more difficult, right? because you don't think of yourself like that, but it's everyone's watching me like a leader. So can you tell me, how has the name of the transformation that your organization underwent was called the Sure Way. So how has that really impacted you as a physician?
As a physician, it's definitely been a great journey. And I think to call it journey is exactly that. It wasn't overnight that things changed. And we already were in a great spot to begin with, but we've really elevated things up. We had our initial meeting with you where you came in, you did some sessions for the staff as a whole. Physicians sat through that. They were more intrigued as to what this was all going to be about, I think, than just grumbling to go to another meeting and missing clinic, if you will. But it's interesting because often physicians aren't in the loop in terms of knowing what the staff's talked to about. They kind of work over here, physicians are over here, and then they somehow meet in the middle. But once everyone's in that same pool, the physicians, when they're seeing patients in the hospital, on the floor, in the ER, in their clinic, it's amazing the rumor mill they hear floating around always.
Oh, for sure. Oh, yes. You are doorpost, listening post for sure.
So it's incredible to hear that. And you knew what was going on. So you're in the know because you knew exactly what they were told. So it really helped you be in the mentality of knowing the direction everyone's going, and really helped steer that ship, knowing the direction it's going. So it was really helpful from the start, from the get-go in that regard. And then we started to see some projects roll out. Just some very basic things that you teach us, which seem so simple in theory, but to get everyone on board is tough. But from the start, just managing up. When I walk into that patient room and know that my staff was taught to manage me up, makes my job way easier.
Right.
And it makes their job way easier when I manage them up as well.
Absolutely.
So
your advice is to include in training right away.
Right from the start. They know what's going on. It's new to everyone. The conversations that the nurses and the other staff are having, the physicians are right there jumping in as part of that conversation, because really it's that conversation that occurs on the day-to-day job that really helps drive that culture.
Great. What about your role as a leader? Because we've already discussed you have a dual role. How has the transformational journey helped you as a leader?
I think several fold. First off, when you're in a leadership role, you of course are voluntold to participate in different activities. No, here really it is volunteer, but really volunteer in. So you get to be on the ground working, and they pull you in when appropriate. So it was really great as a physician leader to see all the teams with the work they're doing. One initiative we had was called No Doc Rounds Alone. Also had some teachers in there with that naming, but they had really developed that. And then I was our pilot physician. And to be pulled into that and be able to give the opportunity to give feedback and really help grow the program really was insightful. And then at the same time, really made you feel like you were a part of it, take ownership of it. And then because there's such ownership among you, that you really just run with it. So the amount of bedside rounding that occurred still occurs, just incredible. People don't even think anything of it. Everyone makes an effort, unintentional or intentional, to definitely round with the docs. So really makes a big difference there. Even as a leader, then it has taught me to be more intentional with my rounding throughout the entire organization as a physician leader. Physicians, as we mentioned earlier, definitely the sounding board of everyone. So you're out there, you're hearing things from everyone, but it also causes you to learn to be more intentional in terms of those conversations with those people that you always talk to everywhere anyways.
Right.
So it's really insightful, the number of things you learn rather than just simply saying hi and how's the weather to the housekeeping staff and the CNAs on the floor. The things and feedback you learn, just incredible. So that really was helpful. As a doc, you always think, I hear everything anyways, I'm out there. But
Yeah.
really, the physician leader taught you to really just be more intentional with that, and really
That's so cool. And having physicians be a beta test, like, and that's what we always recommend to leaders. It's like, find a physician to be your champion. And that stems from some great advice that we got from two fabulous CEOs in northern Wisconsin, Jason Douglas and Luke Barrell, where that's always kind of been their mantra. Because for years, I was either the nurse executive or a frontline leader for my organization. And I could scream till I was blue in the face, please do this, please do this. It's best practice. Look, here's 17 studies, please believe me. But when another physician said, hey, this is the way we should do this, because I tried it in my practice and I love it. I noticed that I'm back in my clinic earlier. I get less phone calls in the afternoon. When I run with nursing in the morning, I get right. So, and then they're like, oh yeah, we can do that. So, that's ever since Jason and Luke, said to us, everyone needs to have a physician champion, and it can be a different physician champion for whatever it is, but you will spark someone's interest and they'll lead it for you and allow them to do that. And again, physicians are like everybody else.
And I do think it creates quite the flywheel effect, where once physicians hear that this other doc's doing something, and say, for instance, their patient satisfaction scores went up or something, they're like,
yes,
they're slightly competitive.
A little bit. Yes.
So all of a sudden they're like, what are you doing? And then they're coming up to you asking what you're doing differently because they heard you're having such great success. So it really just creates quite the culture that everyone then bonds and really drives it forward together.
All right, good. So do you have any stories that you can tell that you think would be great about, that have kind of impacted your practice from the journey's perspective?
I think it's really amazing. We've been on this journey a few years now as to what it does, not just in your practice, but system wide. Mm-hmm. Our culture's become such that thanking people for the everyday types of things they do is not just something that physicians have learned to do, but just this past week, our auxiliary actually wanted to get involved in that culture too, because they can really palpate it around the organization, and
nice.
Created what they called the Hands of Love campaign. We have a Lights of Love campaign coming up in Christmas. They called this the Hands of Love, where they went and individually hand wrote thank you cards to every employee on every shift and hand baked cookies for them. And they started the night shift, and they would come in the middle of the night on the night shift, pass out cards to everyone, cookies to everyone, get some pictures, thank them for what they're doing. And I mean, that goes far. And that's coming from others who really aren't even here every day, but they can feel it so much in our organization that that's just what we do here, that they wanted to do it too.
Right. And those are community members. Auxiliary people are community members. So future patients, if you will, that are probably going to a gas station, going to a grocery store, going to the post office, and noticing, the same. And then they come to walk in your hospital or your clinic and go, holy, what is going on here? It feels different. It is palpable. Oh, well, thank you. I love that story. Thank you so much, Dr. Ramsey, for your time today. And thanks for making a difference with our friends in Pigeon, Michigan. And good luck this weekend.
All right. Thank you. And have a great day.
All right. Bye-bye now.